All right. Good afternoon, everyone. Hope you're enjoying this lovely weather. It's 5 o'clock on Tuesday, April 4th. I'd like to call to order the meeting of the Board of Supervisors for St. Croix County. We do not have anyone for our invocation. Apparently our clergy are rather busy this week, understandably so. So if you'd like to stand for a moment of silence. Please join me for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
And are we doing electronic roll call? Okay.
What are friends for?
Okay. Yes, I realize that. Okay, we have one public comment card, Aaron Sundin and Bill Rubin, regarding the National Small Business Week. Gentlemen?
Aaron doesn't know this, but he's going to go first.
That's fine. That's fine. Did they say age before beauty or something like that? My name is Aaron Sundin. I'm a Hudson resident for 27 years. I work for Derrick Companies in New Richmond, and I'm also president of the St. Croix County Economic Development Corporation. We are here tonight to talk about National Small Business Week, which is coming up at the end of this month and into early May. We had Chairman Long sign that declaration or proclamation today for that. Just a few notes about small business and kind of how it impacts St. Croix County. The National Small Business Week runs from April 30th to May 6th. We as an Economic Development Corporation line up a lot of meetings in St. Croix County with those businesses. Bill does a good job getting that set up. We take pictures, try to recognize them, and do some visits with some of our board members. Small businesses make a huge impact. In fact, they represent 99.9% of all businesses and account for almost 63% of new net jobs. There's an estimated 33.2 million small businesses in the U.S., nearly 462,000 in Wisconsin, and around 2,600 in St. Croix County. I recognize some of the faces here, and I know that they're small business owners right here tonight. One of the things I wanted to point out, and this kind of is relevant just based on timing, but you're probably familiar with the Main Street Bounce Back program that came out during COVID, and it's kind of carried over now, continues to go on. In the west central Wisconsin region, St. Croix County was able to help 174 applications, which is $1.74 million in those Main Street Bounce Back programs. We were behind Eau Claire County by about $500,000, but other than that, we were number 2 in this region. And we tried to be proactive with that, get out and help those businesses and try to fill those vacancies as best we could. And I think that was one of the positive outcomes that came from that program. Bill, do you want to talk at all about your proclamation?
Well, I'm not going to read it, but again, I think you hit the high points. A lot of small businesses. You don't get to be a big business unless you start out as a small business. Sam Walton, if he were around, would tell you that. He lost the lease to his first building back in the day and almost didn't become the empire that Walmart is. So think of it in the context of Main Street businesses, industrial park properties, the butcher, the baker, the candlestick maker. I thought every candle had been invented. There is now a spiral candle on the market. It burns better, it burns slower. They moved over a couple of years ago from Afton, Minnesota. They're doing business in Hudson, Wisconsin. So, you know, I think every day is in reality, as a small business owner, Supervisor Shirley, juggling all of the things. So in reality, it's likely that small business, or National Small Business Day is every day. And I appreciate the support of this board. I appreciate the support of Chairman Long relative to the proclamation. And we're going to get out and visit a fair amount of businesses during that week. Thank you very much.
Thank you, gentlemen. Other public comment? Anyone else for the public like to address the board? Don't be shy. Any other public comment? Okay, we'll move on to our consent agenda. Do we have a motion for the consent agenda?
Move to approve the consent agenda.
Supervisor Burning, do we have a second? Supervisor Shirley. And I believe then we are ready to vote.
Supervisor Shirley, can you just put in your second too?
Do you need to fix the two that are absent?
Yes.
Oh, yeah.
Please stand by. We're experiencing technical difficulties. We will be with you momentarily.
There we go. Thank you. Okay, we're going to move on to presentations. First, we have an update on our Government Center construction project. This will be very exciting for all of us. Taylor, would you like to do the introductions for the project manager? Wasn't sure I was going to call on you, were you?
I'm just going to bring up Kurt.
Hello, everyone. In your packet, you should see our bid tab for bid pack 4 we just bid out. If you go in the first column in the yellow, you're going to see there's two different colors. You're going to see numbers that are green, and you see highlights that are tan. The green ones are the low bids that we accepted, and the tan numbers are the ones we didn't get any bids for. So we're going to have bid pack 6 come out April 13th, and that's going to bid on May 2nd. And the bids that we didn't get any bids was most Division 6 and plumbing. So those are 2 areas going to be rebid in bid category 6. 5 is a AV audiovisual. That actually bids on Thursday at 2 p.m. So we're going to get those, analyze those, interview people. One thing we're going to do in bid pack 6 to make this package a little bit easier, it's a $7 million package, and that's harder for smaller general contractors to bond. So we're going to break that down a little bit, take the casework out of it, take the doors, frames, and hardware out of it. That way let's give more opportunities to our small businesses to get a chance of bidding that. Other than that, get any questions on the overall number? We are in budget. We're at $80,279,676. A little easier presenting this when we're in budget than over. So, Sam, you got any questions for me? Yeah, I got it. Yep.
Yeah, my computer just shut down on me, but earlier I went over the numbers, and I believe we were 200 and some $1,000 over, and we haven't finished all the bids in. Where do we expect that $80 million to wind up?
Right now, we already have our budget numbers in these sheets. So the budget numbers we have for plumbing is listed in here under Division 22, and the number in Division 6 is listed in there. So we do have the budget numbers in there. So we do have something covering it. So it should come right around where we're at. Everything history-wise is coming in right under budget. So some numbers are higher and lower, but they offset.
Well, my question was right off the get-go when I looked at this. I looked at the bottom line,
Yep.
and we're at $80,279,000. So $279,000 right now is over budget.
Yeah. So so we borrowed $80 million. So we've taken that $80 million and we've invested it. So as of December 31st, we had $790,000 in interest earnings. And so we're projecting between $2 and $3 million in total interest earnings while we invest the money before the project's done. So that's where we've given them a little bit of leeway that up to about 82 million, we're probably pretty good. We're pretty safe.
Thank you very much, because then I'll watch the number at 82 million.
Yep.
It won't go over 82 million.
Yeah. Within this line, too, you'll see down towards the bottom, there's a contingency of about $5 million.
Okay.
So that's unknown future potential expenses. So if those are zero, if the architects did a really good job and the bidders all understood everything and no surprises are found, we won't spend any of that. So then the project would be down around 75 million. Now, what we'll do then with contingency, if it's not used for unexpected expenses, is we will add some things back to the project that we had taken off from the beginning. So we could finish the health and wellness clinic, we could build the road over to Vine Street, we could put in solar panels. There's any number of things we can do that were removed from the scope to get us back within budget, and we can use that money for that. We do have to use the $80 million on the government center project. So we'll watch that line item. That's something that, I'm going to be watching every week. But more than likely, any contingency expenses that we do have would be on the back end when we get into the remodeling part, when we start on this part of the building. So really check back with me in 2025 and I'll give you a final number.
Well, I hope I'm still here in 2025.
Yeah.
Thank you.
All right, anybody else got any questions? Any other? Yep, no problem.
I'll just add, too, I was very interested in our meeting last week. The contingency, I believe you said it was about 7%, which is really on the high side. Usually it's quite a bit lower than that. So I think should make us feel a little more comfortable in that number as well.
Yep. All right, well, thank you, everybody.
All right. Thank you, Kurt. And we're going to move on to our next presentation regarding from our public health office, HHS COVID-19 response. So as they're getting ready, I'll just kind of add a couple of comments. I know the last couple of years regarding COVID and this wonderful pandemic has been very difficult and very challenging in many, many respects. We've had a lack of a lot of information, a lot of misinformation, a lot of uncertainty, and it's been, unfortunately, that fueled a lot of the politicizing the issue and divisiveness in the community, unfortunately. So I think I'm glad that Supervisor Burning suggested that we pick this up and let's look back and take a look at what we did and how certain things went well, certain things may not have gone as well as we like, and what did we learn, and how can we better move forward so we're better prepared. And we will have time for a Q&A afterwards, and I would appreciate if you keep your questions within the context of policy. Thank you.
Is this on? Are we good? Well, Chair Long, you just gave my whole first introduction, so I thank you. No, in all seriousness, thank you all for having us tonight. We're going to briefly describe the last 3 years as St. Croix County engaged in the COVID response. We'll do a brief introduction. We'll be sharing slides as we go over our high-level response. So I am Kelly Ingen. I am the health officer. I'm a bachelor's prepared nurse from Viterbo University. I also have a master's in public health from the University of Minnesota. I spent 11 years in local public health and 4.5 in tribal health. So that is my background as your health officer.
Good evening. Thank you for having me. My name is Ellie Clausen. I am the epidemiologist here for St. Croix County. I graduated from Richmond. I have a BS in biomedical sciences from La Crosse, UW, Wisconsin, and I have a master's of science in public health from Johns Hopkins University. My focus groups were epidemiological methods and biostatistics. I joined as the epi in the summer of 2020, and I have about 9 years of experience in research, public policy, and public health programming. Thank you.
Good evening, Mr. Chair, members of the board. That's a hard act to follow, but you all know me. I think I'm Bob Rared. I'm the Director of Health and Human Services. I too have a master's in public health with an emphasis on community and behavioral health. And I'll turn it over to Kelly and Ellie for most of the presentation.
Thank you both. Okay, next slide. Should we let you know when we need advancing? Okay, so a little bit about COVID-19 or SARS-CoV-2. I'm not going to read slide for slide. We're giving you a high-level overview, but first identified, hence the name, December of 19, COVID. Through the last 3 years, we have seen different variants come through, and you'll hear that as we talk through our presentation tonight. Some of the variants have been more virulent, which that's a big word, but they have been more easier spread than some of the other variants. So we do take note when the variants are more virulent, like I said, because we have had people more disease activity when we have seen some of those strains, and we'll talk about that through our response. Next slide. So we tried to give you a timeline. This is one of the things we absolutely could have done better. And I've always said this, so I have a little bit of a public health preparedness background, spent some time in public health preparedness. The most important role in public health preparedness is having a scribe. And for 3 years, I think we did better at some points in the response of having a scribe and keeping really good tabs on what we were doing and when we were doing it and why we were doing it. And as we went back to do our timeline, we quickly found that out. So as you can see, there are different icons on these timelines. They each represent different things, some local, some state, some state government from Governor Evers, some from the CDC, and of course the FDA. 2020 really was using public health measures that have previously worked in the past to fight communicable disease, such as social distancing, masking, and other measures despite a vaccine that we didn't have. Next slide, please. So in 2021, at the end of 2020, the vaccine was coming out, very rampant response to produce vaccines. Our 2020 response really included vaccination and responding still to all the positive cases with disease investigation, which Ellie will talk about later. I think the biggest thing to point out on this specific timeline in 2021 was the little icon of mHealth. So we were at a point in the response where our numbers were absolutely crazy. We couldn't hire enough people to keep up with our response, and we didn't, and we recognized that, and we said, we're never going to hire our way out of this pandemic. So we adjusted and made changes to our response so we weren't overwhelmed day after day after day. But I want to point out this mHealth. So it wasn't just mHealth, but All CEOs in St. Croix County, along with some of the eastern side hospital systems, wrote a letter, and these are the CEOs of hospitals, wrote a letter encouraging the public to really take a look at COVID precautions. I think this was a big deal and spoke volumes about the hospitals themselves being overwhelmed. It was a whole system, not just public health, that became overwhelmed. Okay, next slide, please. And 2022 and today, you know, we were managing the response as well as transitioning back into what we did before COVID. We have laid off all but 2 of our LTE workers. Ellie will talk about a little bit of our LTE workers and where they were at. And now we only have 2 working for us, which there still is enough work. So we are still getting COVID cases, and there still is enough work for 2 people to be in our response. So I think that's all I have, and I will turn it over to Ellie. Next slide, please.
Thank you. So I really want to give the board and everyone here a really understanding of what we did during the COVID-19 response. What was public health's role and how did we carry that out? So going through some basic tenets of our response and understanding that these pieces that you see there are the big pieces of any communicable disease response, and were big pieces of our response. And through the whole time kind of maintaining our mission statement. So we protect and promote health. So next slide, please. Thank you. All right, this slide has a lot of big numbers on it, but this does summarize one of our core functions of public health during the pandemic, which was communication. From the top boxes there, you can see we responded to over 13,000 phone calls and emails from the public. So we set up a phone line, we set up a specific email line, and we responded to every inquiry that came through, whether that was immediately responded by our intake individual or was passed on to another level. As we move kind of through, you can see as part of our response, which I'll touch on later, we do a disease investigation. That's a tenet of public health with a communicable disease. And we actually spoke to 2,985 individuals once they did test positive for COVID-19. These aren't the ones we couldn't reach or these individuals that refused. These are the individuals that our LTEs, our limited term employees, and our public health staff actually spoke to. The 7,000 number, at some point, like Kelly mentioned, we became overloaded, and we did set up an electronic emergency alert system to let people know of the guidance and how to keep themselves safe once they did test positive, because we couldn't call them. We didn't have enough people. The last number there is then we did also communicate via the web. There's another slide, but we did set up a dashboard that was able to track metrics. And our COVID-19 dashboard was updated daily and had over 700,000 views from 2020 to 2022. There has been a lot of negativity, but I did want to include these great pieces. We got many people responding to us by email. The top one being just about receiving a call and knowing what to do, and the second one being about the data dashboard. We received many forms of thanks just from the public and knowing that we were engaging with them and helping them. Next slide, please. Okay, so I want to direct your attention first to the left-hand side of the slide. It goes CDC, Wisconsin DHS, which is the Department of Health Services, that's the state level of public health, and then SCC Public Health. And so as communication, as we were able to deliver the community communication, it first started with the CDC, and then it passed to the DHS, and so the DHS then had to review it and approve it, and then that approved message was then released to us here at the local level. So we understand how much communication was happening during COVID-19, how much guidance was being released, but we had a set process we had to follow, and we tried our best to really include the most updated scientific evidence and guidance we were receiving from the CDC and the DHS. So you can see all those small little bullet points. Those are just different types of messaging and communication that we would receive from the CDC and DHS. Now, if you have the slides with you, I can keep telling you. There we go. All right, so back one for me, please. Perfect, okay. Now, onto the right-hand side, just briefly, obviously, we had internal communications, we had all these LTEs, we had constant trainings, but we also had external communications. Now, if a guidance piece ever changed, or we also had those weekly meetings with other partners on, or daily meetings on what was happening, how can we make for, how are we going to be, just discuss what communications we were receiving and how we were going to promote those externally. So you can see there all the different pieces of regular communication we kept up throughout the pandemic for response, as well as we did press releases. We had our website, and obviously we talked about those calls and emails. Next slide, please. Oh, pardon me.
That's okay. I'm just going to talk quickly a little bit about strengths and gaps related to communication throughout our response. I always say communication is an art, and if you think you've perfected it, you're wrong. Because I feel like communicating is just, you can never learn how to do it better, how to do it more often, how to do it right. I think we did a lot of things right related to communication, but obviously, with things in the beginning of the response changing so rapidly, sometimes we would get guidance in the morning and it would change by 5 o'clock the next day, sometimes even the same day. That was really difficult, and that was a hard message to communicate to all of our local partners. Some of the things we did really good, Administrator Thompson, I believe it was, I joked with him back in May, I think, of 2020. He said, we're getting a public information officer. And I said, oh, are you sending him to public health the first day? And no joke, he did send him, I think, within the first 2 weeks. So Adam did quickly become part of our response and really did help craft a message that, people in public health don't usually go to school for communications. Although we've learned through the pandemic, maybe we should start paying more attention to that. I didn't know what I did before Ellie came to us. She came to us in June or July of 2020. I don't know how I presented to the county board, I think 3 times before Ellie got here, and I thought, boy, those presentations must have been pretty bad. When you have an epidemiologist that can really tell a story through numbers, it does make a difference. So those are some of our lessons learned, definitely through communication. Mm-hmm.
Okay, so the one other major tenet is disease investigation and contact tracing. So this is any communicable disease that public health interacts with. Hopefully all of you are lucky never to get a call about an E. coli infection from public health, but that's our basic tenet, is disease investigation and contact tracing. But that was blown way out of the water with COVID-19. And so for an understanding, we hired 22 limited term employees to help us handle the number of cases. We actually had 4 public health staff return to us. And at some points the workload was so heavy, we had all public health staff and the support staff at HHS helping us with the response. You can see the positive case numbers there and recognize that the goal of public health, as deemed by the Department of Health Services, by the state, is that we do contact every one of those individuals. Now, look at those numbers, and it is daunting. But what I want to show you guys is the other part of this entire disease investigation iceberg. When you would hear me say number of positive cases, this is actually a little bit of a map of what would happen once we received a positive lab. So from the state system that would deliver the lab of an individual in St. Croix County testing positive, we would then send them to our internal tracking system, where they would then be called by public health staff. If they were unable to contact, they would be sent electronic notification. And from that point, they would either potentially be part of an outbreak investigation. We may need to follow up with the hospital. They may be in the hospital. We might need to contact the schools. We had a system for schools if they were a school-age child, because they had separate guidance. We may need to transfer them to Minnesota because they were a college kid and living here. And the list kind of just goes on. So really an understanding of disease investigation was turned on its head with COVID-19. This was a whole new process for us and a new response. And then after all of that, just basic calling and understanding, we had to document all of those pieces. What kind of documentation did that person need for work, for travel, for how many close contacts, who did they potentially expose, where were they exposed at a workplace? It just snowballed. And every time a guidance changed, we had to update all of those staff members on all of these different processes on how they were to effectively communicate with the public with the new guidance. So just a brief understanding of one of our basic tenets here in public health. Next slide, please. All right, I talked about some of these systems, but just know that we mobilized a lot of systems here in public health for the response to COVID-19. Schools, we had a complete system with each and every private school building where we were tracking kids who could come in, their siblings, and making sure that we weren't spreading in schools because that was a very great concern at the time. We had our overflow system, our outbreak, long-term care especially was a huge thing as we knew they were the most at risk. They were the most vulnerable population. Large scale, we had our vaccination clinics, the invitations, all of these systems listed here were new for us, but we mobilized in response to community needs. Next slide. Oh, pause.
That's okay, you're okay. Just very quickly on our systems and our contact tracing and disease investigation. We did have strong partnerships with our healthcare providers prior to COVID through our community health needs assessment. You may have heard of the coalition Healthier Together. We had some of this stuff in place prior to this, which really did aid us and help us when we started having to talk multiple times a day to health systems on the phone. I would say we also had a state system that did overall surveillance on communicable disease, and these health systems were up and running on this surveillance system. It's called WEDS, irrelevant for this conversation, but they didn't have COVID in their repertoire of the surveillance system because it's a new disease. It was new to us. So not necessarily a gap on our part. I'm sure there are things that we really could have tightened up. The interview when COVID for contact tracing when it first started was pages and pages long. And I think the state heard us loud and clear at the local level. We pushed back and pushed back hard and said, this is too long. People can't be on the phone for an hour investigating multiple cases a day. And they did make some changes as that went. So I guess it was in our favor to advocate locally for our staff and for our residents. So.
All right, so the last kind of group of core public health functions is testing. And testing came out rather soon. Testing was a huge demand, and so we partnered with multiple organizations. So starting, we partnered with the Wing, with the National Guard. And so with emergency management, they started up Wing testing early in 2020. I believe it's actually May, but so October up there. But just so you look for it, after that, there was on-demand testing. We had group homes asking us to come in and help test their residents. We coordinated with jail outbreaks and assisted living homes. And so all of these pieces, and then it evolved into the understanding that we should have a centralized testing system at the HHS building. And so we held testing there twice a week throughout 2021 and 2022. Next slide. The other big tenet was the rollout of vaccination. This, we had to partner with emergency management, sheriff's department. We had volunteers for the Medical Reserve Corps. We had public schools, workplaces, even coordinating the amount of vaccine with other counties and with the hospital systems was a huge piece for us. We were set down, the priority groups were given to us, but people really wanted the vaccination. And so we did have to set up an appointment system, which we had never used iPads and an appointment system. But because it was a huge tenet and needed by the community to slow the spread of COVID-19, we did end up vaccinating over 10,000, or giving over 10,000 vaccinations. And Mary, our preparedness person, was very essential in helping those systems be set up, and she received multiple thank yous for people literally saying, "You probably saved our lives," because she was able to help them get into the vaccination when they wanted it.
And quickly, just for strengths here, I don't want to downplay the role the Sheriff's Department and Emergency Management played with us and for us. Janet Smith, bless her heart, hope she's doing well today. She was amazing. She worked hand in hand with Mary Winky, our preparedness person, to really coordinate these clinics and make scheduling available. It was a big deal, and we couldn't have done it without them, as well as law enforcement being at multiple locations with us. Testing, some of the gaps in testing, I remember really early in the response, before Ellie was even here, our hospital systems were calling and said, "We don't have enough lab capacity to test all the people we can test." So the actual test itself was very easy. It was a medium and a nasal swab. So they could essentially make these test kits in their own healthcare settings if they had the supplies to do it. It was the testing piece, the actually analyzation of the test, that was really, the capacity was just at first, like, overwhelmed. So healthcare systems quickly partnered with each other. They quickly learned that, bigger systems in the cities and Rochester were able to run more tests, and they partnered together to get those tests run as quickly as they could. I mean, it was a process. Some days it felt like 3 weeks, but that's what I have to say about testing and vaccines. So, next slide. So we did ask our staff. We obviously want to hear from our staff, constructive criticism, if you will, and just an overall. Our staff, one of the things I can say as the leader of the organization, I didn't do well enough checking in on staff all the time. I think some health officers did a really, really good job about assessing the workers' capacity in their own mental health, because there were some days that were pretty rough. There were some days that were pretty good, but I will say personally, I think we could have done a better job. I could have done specifically a better job with really assessing the mental health needs of our own staff. But this is what our staff said when we gave them a survey. They said one of our biggest strengths was our staff. I have some really good quotes. I'm not going to bore you too many with them, but we had devoted staff who rolled up their sleeves and put in unlimited number of hours. And I think Ken probably remembers the unlimited number of hours that he had to look at. Meetings were held twice a week. This is kind of related to the systems and communication with community partners, and designating public health staff liaisons for other partners. We did have a specific liaison who liaison between the public health department and all of our long-term care facilities. Another health officer from another county right next to or close to us said, "Do you think that's why you've had so few deaths in your nursing homes?" And really, if you remember, and we're watching data, we were one of the lowest counties for deaths in nursing homes throughout the pandemic, which was really quite remarkable. Now, can I draw that right back to this liaison we put out there? No. Could it have hurt? No. So we can't prove that helped, but I think some of the things we did were a little bit innovative and did help us do better in some areas of the response. So gaps, communication with the staff. Like I said, communication is an art. So we started off in March of 2020, all staff on board. So our WIC staff, our environmental health staff. And then as we got kind of a handle on what was going to be asked of us by the state and what we were going to have to do, those programs went back to doing their own work. And they weren't always included in our COVID communication. So communication external, I think I have something from there. all staff should have been included in the majority of meetings from the start, which they were, but you know, it's been 3 years, maybe they've forgotten that too. One of the things, another gap, the incident command system. So that really is a system, some of you probably know, started by the fire and law enforcement. This is a system they use. This is a system that really became public health heavy after 9/11, when public health preparedness, when public health was looked to do some of volunteer management and different things. That really takes an incident command system to use. I think in the course of 3 years, there were so many pieces of this response, and with a staff of, well, we had 22 and then we had 16, but with a staff of less than 50, it was hard to really utilize incident command day in and day out. I think we used it really well during our mass clinics when we were doing vaccinations. So I think we will turn it over to Bob, and then you can ask your questions.
Thank you, Ellie and Kelly. I do want to take just a moment to thank both of them for their dedication throughout this pandemic in trying to stay objective and trying to stay out of the fray and doing the right thing. I think that goes for all of our public health staff, who oftentimes took some of the anger or frustrations from the public. Personally, it's hard not to, but they tried to look beyond that and to say, where is that anger or frustration coming from, and how can we do things differently to help mitigate that? You know, local health departments were primarily responsible for the front lines of this pandemic and responding to this pandemic. We took our guidance, of course, from the state, from the federal government, but we had to translate that guidance into local strategies that would make sense for our local communities. Or we tried to. That was our intention. I know one of the things that spooked me when this pandemic began was emerging in Wuhan, China, was the fearful or panicked response that Chinese officials had when this pandemic was not contained. And what scared me, I was in Hennepin County at the time in a conference room or something, watching this sort of unfold in the data. And it was their fear of this virus that really spooked me. And I knew something very bad was coming. And when it did hit us finally in St. Croix County in May or June of 2020, when our first cases started to emerge, it was very evident that local health departments who were going to bear the brunt of this were not well prepared. We didn't have the infrastructure to respond to large-scale testing clinics or vaccine clinics, or how to communicate, as Ellie and Kelly said, in real time to an evolving pandemic for a virus that we didn't well understand. I think the addition of the epidemiology position that Ellie Clausen has, certainly Adam Kostanek as our public information officer, those two positions were key, excuse me, were key in helping us to build that infrastructure and to communicate with the public. We weren't perfect, certainly in doing that, but again, when we tried to design communication strategies, we tried to think what kinds of messages would resonate with people and still adhere to the science and the guidance that we were receiving from the feds and the state. So we tried to apply, we tried to incorporate key positions, both Ellie and Adam, of course, but also these limited term employees to help us with expanding our infrastructure a little bit, at least temporarily, to help with vaccination clinics, testing. Contact tracing was a big one. My wife even helped as a contact tracer for a while, and I didn't get any personal information from her about anybody she talked to, but I could tell by her face that some of the calls didn't go well. It was a difficult job, right? And they did this day in and day out. They would call people with the intention of trying to help them understand what they could do next if they tested positive. So our infrastructure was obviously challenged, and that's something that we continue to look at going forward. How would we respond differently going forward? I think we know better now, certainly, how to put together testing, larger operations for testing, vaccination clinics, et cetera, because we have now gone through it. In the moment, we were doing it, sort of building the plane as we flew it, and I think we did a pretty nice job at that, all things considered, given the extent of the coordination that was involved. Also, the public, I think, had a limited understanding of what the role of public health is. And that's not a criticism. That's just to say that there was no need for most of the public to understand what public health did on a detailed basis. So when this pandemic hit, it put a spotlight on public health departments and a magnifying glass. And suddenly, the public became very interested. So going forward, I think what would be helpful is doing more, having more opportunities to do this kind of thing, where we describe what we did and why we did it with respect to the pandemic. But also it gives us an opportunity to talk about other things that we do as a part of public health. Population health and how we look at communities and the state, or even nationally, how we look at health from a kind of from a distance, right? So we look at how disease operates within populations and how can we take steps to help mitigate or prevent disease from spreading. And that goes for everything from communicable diseases to addiction to mental health. How do these diseases function within a population? So we can do more of that, and as a part of that, also describe why we did what we did during the pandemic and what we could do differently going forward, or what kinds of things would be helpful going forward in terms of infrastructure, of staffing and stuff. I'm just looking through my notes because Ellie and Kelly covered some of what I was going to talk about. This event was unprecedented, at least in our lifetimes, so everything from December of 2019 till now has been a learning experience, and we pay attention to that and have paid attention to that throughout the pandemic. Some of the things that I've mentioned and that Ellie and Kelly talked about are the kinds of things that we'll look at going forward. Communication, building trust with the communities, with the public, with all of you, so that you know at least why we did what we did and what our intentions were. And I think I'll leave it at that because you may have questions for us or want more information about something.
Thank you. I think we're ready for anyone that has some questions for our public health. Supervisor Shirley.
Just a question about, to go back to your testing slide. You talked about the wings testing and testing at HHS. You talk about the positive labs, when you get a positive and then we'll go back to public health. Was it just those two that you were getting your information from, or is it a larger, and how were you getting that?
Yep, great question. I think I understand completely. So I did mention the surveillance system that we have built in the state. So what happens when a positive lab comes in, even if I go get tested in, say, Chippewa County, that is my address is going to attach that I live here in St. Croix County. So even if I get tested there, it's still going to come into our jurisdiction. So the testing slide that we had, just because we tested people here, doesn't mean that was the only cases that we had. Did that answer? Okay. Okay.
Other questions? Supervisor Lind.
Can you talk to me about what a PCR test is?
So a PCR test is a I always screw this name up. It's a polychain, you got it? Polychain So I don't work in a lab. But
It's
the
okay.
the PCR test is like the gold standard for COVID testing. Because it's not an antigen test and it's not an antibody test, it goes through rigorous testing within the lab. So the PTR test is the gold test or the gold standard for COVID testing and was for a long time. And that, as you can see, like through COVID, the years of COVID, that really changed, right? So PCR test, you heard in the first couple of years, PCR test, got to be a PCR test, got to have that PCR test. And that really has changed since year 2, mostly year 3. Now we have people at home testing. So like, I believe there's more probably disease in the county that we even know because people are using at home tests or maybe not testing anymore. Ellie, do you want to add anything about PCR testing?
No, I guess just so we're aware, all of the testing samples that were sent in, they were analyzed at the lab. They are polymerase chain reaction. That is the piece of the testing. And really, public health only stepped in. We provided testing, but all of our testing samples, once we had performed the sampling, those samples were sent off to a lab. And so public health only started our process once this Wisconsin electronic disease surveillance system kicked us in a little file that says, hey, this individual, here is their positive test. We had no interaction with an actual PCR test.
Okay. One more thing. Do you know Dr. Carrie Mullis? Have you heard that name?
Are they local?
Yeah, are they local? That was my question.
He's actually the creator of the PCR test.
No, I don't. I'm not familiar.
And he said early on, anyone can test positive for practically anything with a PCR test. If you run it long enough or enough cycles with the PCR, if you do it well, you can find almost anything in anybody. It doesn't tell you that you are sick.
Well, I think what I would say
He
to
was
that-
murdered shortly
Oh,
after
I'm
saying
sorry.
this.
I didn't mean to interrupt.
He was murdered.
Sure. What I could say about that is I did talk a little bit about all the testing capacity and how hard it was to find testing capacity. So I would be very, very surprised if they kept running the same sample over and over to get a positive test.
They did 40 cycles and it was supposed to be less than 20.
Sure.
And that's a hard hit.
Sure,
So-
absolutely.
And I'm sorry, I think that COVID is very fear-based, and I
Sure.
think that it's an unfortunate
I thought this was point of order.
thing.
Supervisor Lee?
This was supposed to be related to policy questions.
Yes, thank you.
I didn't see policy, sorry.
It was stated by the chair before the presentation.
Supervisor Carlson.
Thank you, and thanks for your report. The very first slide, you said a new type of vaccine, mRNA vaccine, was tested and has been proven safe and effective at preventing severe illness. But you, conspiracy theory or not, I hear all over the place, people are getting myocarditis, if I said that right. They're worried about side effects. VAERS reports a lot of side effects. So what is the public health department doing to address those fears, help alleviate the fear among people? And do you believe that the fear is warranted at all or not?
Great question. Vaccines, since they were invented, have always been challenging. It's always challenging to look at a healthy human or a healthy baby and give them a shot. That's always been the concern with a vaccine. What's going to happen because of it, and is it going to work? The COVID-19 vaccine, the mRNA vaccine, was studied for multiple years prior to it being released to the public. mRNA. What did I say?
COVID mRNA.
Sorry. The mRNA vaccine. It was released as a new because we don't have any mRNA vaccines currently on the market. Currently, that we even have in a schedule that's recommended. And so from that technology, the studies that have been done on the mRNA vaccines and on the COVID vaccines, all of that information is kind of the biggest piece for me that speaks to it is that the ACIP, which is the advisory committee that makes the decisions about the vaccination for the entire US population, they published the safety studies on the COVID-19 vaccinations. And due to those safety studies, they have recommended that the entire US population be vaccinated. And so here in St. Croix County, and that is using VAERS data. So VAERS is the Vaccine Adverse Reporting System. Anybody who receives a vaccine is able to self-report any adverse event that they have, whether it is conclusively tied or it just happens by chance. They don't know, but they do report it, and the CDC then does examine that data and looks for spikes. And so, but all of that is done at the federal level. Unfortunately, that information is not shared with us at the local level. And we have not done for, and I recognize it's a lot, for the over 10,000 vaccinations that we gave, we have not been able to maintain a follow-up safety system. We leave that to the federal and the state level.
Which they did have.
Which they do have.
Yeah, they did have. If you did receive your COVID vaccine, you could select to check in. How are you doing? How are you feeling? Are you having any side effects? Multiple times post-vaccine, so that did happen. I am going to comment because I'm a pretty transparent person, and I'm a mom, and I'm not going to cry. I did think about, I did delay my son's vaccine because there was a study that came out. There was a study that came out on young men and myocarditis, which is inflammation in the heart. And I did delay that because I wasn't sure. It is very new. It's a new vaccine. He is vaccinated now, which has no making on it either. But yeah, I mean, there were a lot of times during this pandemic where you had to stop and think, what's okay for my family? And really, when it comes to vaccine, thank you, Adam, that is kind of what it comes down to. What's right for you and what's right for your family? But that's my story. Sorry, I apologize. Sorry. Yeah, you bet.
Supervisor Anderson, I believe you had a question?
Yeah, are we, as a county, still continuing policy, still recommending mask usage? Because I forget the name of the organization, but in the UK did a study on the effectiveness of masks, and it's basically they compiled the information from, I think it was dozens of studies, to determine that masks were almost useless, at least the type we're using, the general public uses, because COVID is aerosoled, so the virus will just go right through it.
All right, so 2 parts, and I'm sorry, if there's multiple parts, please remind me if I have not answered them all. First part, we currently here at St. Croix County are still following the CDC guidelines, which is a recommendation to prevent the spread of disease and prevent yourself from illness. So the community levels are based on our current positive case count, so those positive labs that come through, as well as our hospital capacity. Yep. So, and our admissions for COVID. So St. Croix County is currently at low, which all of the recommendations, and I don't want to be misquoted, so I'm not going to say them to you exactly as they are. But so all of those are readily available, and that's what we here at Public Health are still recommending for individuals, is following from. It's currently on our data dashboard. There's a link, as well as the DHS, the Department of Health Services, the state level. They recommend the CDC community levels, and then the CDC is still recommending those. And I believe you're referring to the Cochrane review, correct? Yes. The Cochrane review is an interesting study. And this is what makes science so great and so challenging, is that anyone can read a scientific study, and no matter if you have a master's in biostatistics or you don't, there leaves room for potential misinterpretation. Not saying that you do, but the Cochrane study was very trickily worded. And so it does say that masks are not all made the same, right? The kind of gaiters people were wearing, those really did nothing. Like N95s, that's our good goal. People wear them in hospitals. You know, there is a graduated effect of masking. And the Cochrane Review really looked at if we are to tell people you should mask and we don't specify and it isn't, and dependent on the type of mandate, they looked at that no, the type of masking that was done was not effective. Now, did they consistently collect self-report? So were you masking? How often? Did you take it off? Did you sit next to someone? And how often were you? So what we can find out is that the comprehensive data is flawed. It is always going to be flawed with masking because we can't get a true impact. And so, but what we do know is that because, yes, COVID is aerosolized and it is droplet-based, that if you properly wear an N95, that prevents those droplets from getting in. And so that will prevent you from, that will reduce your risk. You can't say prevent because you're going to move it around and take it off and it's never perfect, but it will reduce your risk.
Supervisor Burning?
Thank you very much for putting this together. That was very comprehensive and pretty close to what I was looking for. There's a couple of things that I also need. So first and foremost, how many deaths did we have? I never saw this in the report up to date today due to COVID-19 from December of 19. So, I mean, you don't have to say it now. You can get that to me in an email. But there are a couple things specifically relating to policy that I'd like for us to explore, not only as a county board, maybe as a state legislature, and maybe as the federal government to look at. There's a lot of pushing of this vaccine, and prior to COVID, I was not anti-vax. As a matter of fact, I was a very strong proponent of vaccines. But having left my job because of a mandated, mandated vaccine, I am now very hesitant on all vaccines. So I make that statement so that you understand where I'm coming from. Knowing people that have had adverse side effects from the vaccine and knowing of at least one particular person that passed away the night that they took the vaccine, I think it's important for us to explore the possibility of really, not only when we promote this as safe and effective, but making sure that people understand that there is recourse, specifically through VAERS, that people are able to do that without fear of reprisals in any sense. So I say that kind of tongue-in-cheek in the sense that I know people that did have adverse effects, a seizure twice with 2 shots, and they were, no pun intended, I shouldn't even say it like this, deathly afraid, but they were very afraid based on where they were to report that adverse effect. Shattered my heart to a million pieces. That person is no longer with us. That was 1.5 years ago, 2 years ago that happened. Two times, and then a third time when they got a booster, same thing happened. So what I'm getting at is that we should really explore as policymakers, as public health, how we can let people understand that because there really is no recourse due to legislation in the 80s, to go after someone to go after the manufacturers of these vaccines. We're going after them for everything else. But I'd implore you to help us as policymakers craft something that our state legislators and our federal legislators on both sides of the aisle can craft so that people understand and really understand that we put it out there that there is a way, like they don't necessarily have to take it. And 2, if they do take it, there is ways to make sure that follow-up care is available if they do have extremely adverse effects, and there's a way to report it so that you folks at Public Health and those around the state and those around the country can track that so that our citizens and our residents and our constituents can make better choices for their health in the long run. So I would ask for your help on that, and I think we should take that on as policymakers. The next questions are actually for Bob. They're both considering his final synopsis here. In World War II and in all subsequent wars before and after, when the fighting was done, the military flexed way down because of the overspending that happened. What we learned in the last 3 years was, like to your point, is a very expensive lesson. I mean, I bet you don't even really know how much it costs to deploy all this, because you were handed whatever materials you needed at times, right? Not necessarily writing a check. But what is public health going to do, and what are other areas of government going to do to kind of flex down and give the private sector and the people a kind of a reprisal on, I mean, we're paying the price right now on everything for our response to COVID. Eggs, gas, energy, cars, trucks, labor force because people are afraid to work or retired early, paying off loans that we wrote to ourselves for ARPA money, CARES money, $1,400 stimulus checks. I mean, the list goes on and on. I don't think you need to answer that today, but I guess I'd more or less implore you to kind of take a look at that and go, all right, what are we going to do to kind of back down and ease off a little bit from a very, very, I'm going to choose the right words here because I don't want to be, I know you guys' heart was in the right place, but it was very, very big, very expensive response. And that's the truth, right? We're going to pay for this for a long time, probably decades. How are you going to help policy-wise on that? And then this one, I would like, that one I don't need an answer on right now either. That's a long term.
Mr. Chair, is this a presentation?
I would say also that part of that question, Supervisor Burning, if I can interject, is more of an opinion on your part that others may challenge. And so
I'm asking from a policy perspective, Mr. Chair.
Yeah, I don't want to ask a question based on your personal opinion being a fact. I think you need to make sure you're clarifying that your personal opinion that we're going to be paying for this for decades is a personal opinion. So
my questions state around policy, and I think that's okay. I'm laying out why I'm asking this question. I could have just asked the question without the foundation for why I'm asking it.
I know, I'm just saying that your question is based on your personal opinion.
Okay, so CARES Act,
and the answer
that was borrowed
there may
money.
differ
ARPA,
if someone has
money.
Excuse me, your answer may differ based on if someone has a different personal opinion. Is the
okay,
point
that's
that I'm
fair
trying to
enough.
make.
Thank you, Mr. Chair. So that is my question, doesn't need to be answered today. My next question is, you had a statement in here that said, I want to quote it directly. We are better prepared for future pandemic emergencies, but work still needs to be done to strengthen local health departments. What does that mean?
I think the work that needs to be done with local health departments is, and not just specifically us, but all local health departments in Wisconsin who are responsible for responding to this pandemic individually and collaboratively, is to look at their staffing structures primarily. Like I said, we added an epidemiologist when a lot of counties didn't have the opportunity or the funding to do that, or they couldn't find an epidemiologist. So having those kinds of key positions, the communication piece, which we have in our public information officer to an extent, but the public or the communication piece within a public health department to not only convey messaging around things like this, which I hope don't happen again anytime soon, but also around other kinds of public health campaigns or messaging is a key aspect of what we need to have as a public health department. The temporary staff that we hired, the LTE staff, can be utilized in short-term responses or special projects maybe that are focused on a public health matter, and then they are they're limited terms, so their time ends as soon as the need for their work ends. But that's what I was referring to, was the infrastructure of public health departments. It was they were all, for the most part, I think, really caught off guard by something of this magnitude coming along and not having the ability or the knowledge or the positions that were necessary to respond in an effective way.
So just a quick follow-up to that. So is that more or less like making sure that maybe the hierarchy is in place and then you can plug in where needed quickly, or like what does that exactly mean?
Well, I think I'll speak for our health department. Looking forward, we're going to be more focused on population health, and in that vein, then having an epidemiologist is essential for that kind of vision, right? So we're looking at how do we devise strategies and public health campaigns for the broader public, and focus less maybe on individual kinds of intervention strategies. So a broader perspective on public health involves population health, which involves needs like an epidemiologist, and public health educators and things of that. So I'm talking for our preparation for the future, it's going to involve some communications pieces and some biostatistics and epidemiology components. That's how we've already done that, and our public health educator is temporarily funded through some of that COVID funding that you referenced, but that's time limited, so we'll have to find other funding for her if we want to continue that position.
Super, and I just wanted to compliment all of you on when you're dealing with the public during a panic time. Thank you for poise and staying. I understand you can take things personal. I take things personal, probably more so than I should at times. So thank you for serving the public, whether it was the right thing or the wrong thing. Thank you for doing so. So thank you. And thank you for your good attitudes today. I really do appreciate that.
Mr. Chair, could I say one other thing?
Absolutely, go
very
right ahead.
quickly, and it's in relation to something you mentioned, Supervisor Burning, and I just want to point this out. It's not to open a can of worms, but the debate about individual rights versus the greater good of the public is something that came up during this pandemic. We all know that, and that's not new. That's been around since public health became a profession or a body over 100 years ago. That debate between my individual rights versus the greater good of the public is something that I think as policymakers we have to consider, or you have to consider, going forward, because that is a key feature of what public health seeks to do. It's to protect the larger population, and that's where a lot of the advisories and the recommendations come from, is to protect the vulnerable and those people that don't have a defense against something like this. So I just wanted to mention that it's not a new debate, but it is something that will continue going forward. So we have to think about that. Thank you.
Supervisor Van Summeren.
I'm glad, Bob, you mentioned that, because I was reminded that 1 year ago, as I was knocking on all of the doors in Baldwin and meeting all of the dogs that were friendly and not so friendly, that well, one of the big things that came up, and I would say by 65% of the people I talked to, was the idea of the policy that was being made that the police could come in and take your children away if they didn't have a mask on. Something that was coming out of HHS, but never did, fortunately. Well, it was out there. So again, that brings us back to communication. So either there was poor communication in that area, or miscommunication, or no communication at all. So I want to encourage you, as we're looking for ways to better ourselves, because if we learn nothing from this, then we waste a lot of time, and as Mr. Burning said, a lot of money. So I think we have to learn from it. But anyway, that was one of the big hot topics in our area about people making decisions for themselves versus somebody else making decisions for them. I can see both sides of it to a point. However, now that the dust has settled and we read of other, for instance, Minneapolis, St. Paul, because I get their paper, talked about how we overreacted to many of these things. And I think that's part of what the people saw also. So you may not have seen that, you worked with it. Maybe the public saw it because they didn't. Thank you.
Supervisor Barlow.
Again, wanted to say thank you for the report. This is good. It's thorough. My question really is during these interviews that you guys would do for tracking, did you guys do anything to advise for supplements or therapeutics to get through COVID? What I've heard from a lot of people that have had it, and I've had it myself, that they're just maybe given antibiotic and sent home. They might have been given an antibiotic and a steroid and sent home, but nothing to really get through it other than that, and ended up with either long haul COVID or ended up in the hospital. So if you guys would like to, please go ahead and answer that.
Yeah, so the piece about our disease investigation and contact tracing is that we are provided a script by the State Department. It is a job. We aren't allowed to insert our personal opinions into these conversations. We are allowed to give the guidance that come from CDC, scientific evidence as they have been changed and modified, but truly we're not allowed to insert our personal opinions into it. And so if it wasn't kind of a tested large-scale trial and had been recommended by the state, we at the local level couldn't have recommended it.
Just a quick follow-up. So what are their guidelines?
What are the current
from
guidelines
the CDC
for COVID?
or yeah?
So current guidelines for COVID-19 are to be aware of your community level. So like I said, on our dashboard, we have our community level. We're currently at low. There are specific guidelines related to masking at those levels for prevention. It's all dependent on spread and hospital capacity. And so those guidelines are laid out in terms of prevention measures. Beyond... you can go ahead. Sorry, I haven't done a disease investigation call. It was like, I am not the person that still calls people.
I was thinking the same thing for Ellie. I haven't done an investigation call since the very, very beginning of COVID, but if I test positive today, is that kind of what you're asking, like what the protocol is?
Yeah, I mean,
yeah.
Obviously you can't give a prescription.
Correct.
Can you
right.
give any kind of recommendation like, hey, take vitamin D and vitamin C?
Like Ellie said, so this is, as a nurse perspective, this is what I would say if somebody asked me that on a disease investigation. What I have heard, some of the common supplements or different things that can help with COVID, I would probably make sure this is okay with the state, that I'm not veering from their recommendations. But we know vitamin C it probably isn't going to hurt you, right? It's probably not going to hurt you. Vitamin D as well, but it's everything in moderation too. So I would want to make darn sure with the state that I am giving advice that they are okay with as well. And I don't know how much that came up during, I'll be very honest, I don't know how much that came up during our disease investigations and how many times people asked about those alternate, therapies that could potentially aid them in getting better or not. So I can't answer that for you. And I don't know how we would ever pull that.
Well, but what I do have to say is, as I feel deficient in my job for not knowing this, to tell you right now, it is available readily to the public. So I can feel Adam in the background saying, our COVID-19 website, Ellie. Yes, yes. All of that information is continuously up to date, as well as the links on our data dashboard that will direct you immediately to the state, to the DHS, which is currently the holder for kind of the guidance. They do reference to the CDC to the community levels as well. So the community has that at their fingertips from our website.
Supervisor Carlson.
Thank you. Just a quick follow-up too. Are we keeping track or have a mechanism to keep track of possible health effects from the vaccines? And then to identify if we have a public health problem now, or if we do, what we do about it. to help us make policy and to help alleviate people's worries. Because I do hear a lot of worry about, you hear sudden death, and some people advertise on Facebook every person that dies is all suddenly, oh, it must be the vaccine or not. So.
Truthfully, so the VAERS system has been around. I mean, in grad school, I worked on pregnant women who were being vaccinated with the flu vaccine and reports that came through VAERS. So the VAERS system is a very established system. I know for a fact when we, and I cannot speak for others, during all of our COVID vaccinations, we gave printed handouts for everyone to access the VAERS system, and then they actually created another system as well, specifically to follow up on that. Now, to say here, us at St. Croix County, our ability to follow up on adverse events, we don't. We just don't have the capacity. I am only the one data, and there's a lot of data. So unfortunately, not at this time. Mm-hmm.
Supervisor Fiedler.
I have a more general health question. People did have legitimate concerns over taking the COVID vaccine given its rapid development. And I've heard that nationally that there are a number of our very difficult, serious diseases where we've had very long time tested vaccines that have proven for decades that have worked very well, but are not being given in large numbers. Can you confirm that? And what's the status, particularly in St. Croix County? Are we lacking in vaccinations for diseases like measles and tuberculosis and other things that we should be getting vaccinations for, given the long history of adequate vaccines for those diseases?
So I don't mean to answer a question with a question, but do you have a specific disease you're talking about? Like
measles and tuberculosis.
Oh, measles and tuberculosis. So we don't give vaccine for tuberculosis. We do give vaccines for measles. Measles vaccines, I think, have been proven quite effective. I think there has been a lack of uptake or people getting vaccines over the past, 10, 15 years probably. And we have seen measles outbreaks. In fact, I was just on a webinar today with a lady who was a health officer in Wisconsin, and now she runs a big organization out in Washington, public health related. And she was talking about the measles outbreak they had at the same time in the state of Washington, while having COVID, while trying to deal with the COVID response as well. So I just want to make sure I answer all your pieces. Tuberculosis, no vaccine. I don't personally know why we don't study that. TB has been really eradicated in a lot of places. Certainly not in third world countries, but we don't see a lot of active TB here. Yes, please, save me, Ellie.
So we do examine, especially in school-age children, the vaccination rates and the uptake. And we have the schedules, and and we are aware that they are behind. And so what we have happened, if you have heard of public health as part of a bigger coalition called Healthier Together, it's with Pierce County. Anyways, under that, one of our public health nurses, Kesslin, has indicated an objective to re-up the immunization coalition, which is area hospitals, and to come up with innovative ways to communicate with people that these vaccinations are important, and how to kind of regain that trust and try to rebuild that kind of distrust that came about because of the COVID vaccine release over time.
Actually, that was going to be my follow-up question, and that was the perfect answer. We know about it, and we're doing something about it. Thank you.
Any other questions or comments? I'll just add one thing. Go ahead, Supervisor.
So first off, I just want to start by saying thank you for the work and the efforts that you've put into this, and you can tell that this means a lot to you, and you had a very strong, conscientious effort to try to make this work for St. Croix County, and we owe you a debt of gratitude for you and for the entire Health and Human Services staff that was involved in all of this. So thank you. The one area, one of my questions was kind of half answered, so I'm going to leave that one alone. But the other one you'd mentioned was incident command system was one of the things that
Done better.
we could work on. Do you see a way that for the future that we might be able to communicate that with the incident command structure that we have in the county here, with their systems and also with the local incident command structures and all the other local levels of government, and see if there's a way that we could work to make this so we have a stronger system for the future?
Yeah, so great question. And I think we talked halfway through the pandemic about towns and townships. I think I remember it being online. So we just exercised actually with not as small as townships, but with our hospital partners, with our EMS and our emergency management at the county level. So we do have exercises, not designed always around communicable diseases, but this scenario happened to be a Ferris wheel and in Glenwood City. I'm sure someone here is from, a couple of people probably from Glenwood City. The Ferris wheel broke. And we had a ton of people to evacuate from the fairgrounds. In emergency management, scenarios like that come up, and we do practice. And I will say, public health is not always often thought about in that response because we were kind of late to the table. Like I said, ICS really started for public health after 9/11 when we were tasked with other things like how do you manage volunteers? And that was because of all the people showing up in New York trying to volunteer and help out. So that was one of the things public health was tasked with, is really managing some of that. I think continuing those conversations, the LEPC, the local emergency public, what is that? LEPC. It's ran downstairs, emergency. Yeah, Kathy is on that, Supervisor Leaf. So I think continuing, getting as many people involved in that, but I know there is kind of this sense of how many is too many, right? Should it be every emergency manager from every township across the county? I don't know the answer to that. But I will say continuing to exercise and being, up on preparedness language and making sure all of our staff are trained in preparedness, which is a requirement within the first 6 months of hire. So we do have things in place to keep that at bay, at least, or in the forefront.
Go ahead.
Yeah, as we go through, I know a few years back I helped with a exercise like that in New Richmond with railroad, and they had railroad representatives there, and as we just had incidents happen in several places through the country, one of the big things that we found at that incident was that we did not incorporate public health like we should have, and so that's why that was part of my question was working on these types of things, and this interaction with all these different pieces together makes these types of things smoother and potentially less hazard to the people that we represent. So I guess it's something I'd want to see us continue towards.
And I absolutely agree 100%, and I think it goes back to people not knowing what public health can do and what we can bring to the table, and it's partially been spoken about tonight here. So yeah, I agree 100%.
Any other comments or questions? Well, thank you, Kelly, Ellie, and Bob. Personally, I think this was a very important conversation to have, and I hope we'll keep talking about it, and so allow us to move forward and be better prepared. So thank you very much. Okay, we're going to move on to our county administrator's report.
Great, we're about halfway through the evening. So the financial report is in the packet. If you're like me, I start a book, I read the first page, and then I read the last page, and then I decide whether I'm going to read anything in between based upon whether I want to find out how I got from point A to point B. So if you read the financial report the same way, and you drop down to the last page, you'll see that there's a negative $5 million compared to last year when we were about 200,000 plus. So that tells me I want to read more of the pages in between. So I did trace that back. So what that is, it's debt service on the government center. We made the first payment, about $5 million. And so that's a new payment in 2023 than we haven't had in prior years. The revenue side of that is spread out throughout the year. We recognize 1/12 every month. So we do catch up back to that. But that's one of the things, I'm sure you all saw that, and we're going to ask anyways. So I thought I'd point that out. Yeah, kind of, yes. And then the only other thing I was going to point out about in the financial report is Election Day is today. There's a referendum. It does have a huge impact on financial decisions that we're going to be making in the very near future. So if you haven't voted yet, do make sure you get out and vote. And I want to take this time to thank the staff, Sheriff Knutson and his staff, District Attorney Anderson, and our Public Information Officer, Adam Kostanek, for all the work they've done in communicating to the public, trying to provide them with information so that they can make an informed decision. We have a web page that we created that's had over 2,500 views, over 10% of which were just today, so the web page really spiked today. Yeah, and we did have postcards that were mailed to every resident, so everyone should have received a postcard that points them to the website and had a code that you could scan with your phone. They did over 20 Facebook postings, so they have about 30 to 40,000 views. I don't know what that means on Facebook, but I guess that's a lot. We did 11 public meetings, including 2 open houses here at the Government Center. And then we did press releases and interviews with the media. And the River Channel video, which we pointed to, has over 4,000 views to it. So the staff, I just wanted to point out that the staff has done a great job of getting the information out so the voters could make an informed decision in today's election. Any other questions on the financial report? Okay.
Okay, we'll move on to our only business item of the evening, confirmation of our finance director. Ken?
Yeah, I'd like to introduce Chuck Myers. He's in the audience here, been patiently waiting as our first business agenda item. Yeah, Chuck has decades of experience as a finance director. We're really looking forward to his experience joining our team and leading the finance department. So I don't know if you want to say a couple of words, Chuck, or maybe we can get a motion and a vote too. Maybe we could approve them first.
I suppose that would be appropriate, so we do... Who was the second, I'm sorry? Who? Oh, Supervisor Lynn, got that, Christine?
No, the second.
Okay, any discussion? Good, let's vote. Okay, lots of green.
Look at that.
Okay, Chuck?
Unanimously approved. So Chuck has a projected start date of April 24th. So that's when he'll be joining us. So he'll be seated by our next county board meeting. Say a couple words, Chuck.
I appreciate the opportunity, and thank you. And I'm pretty excited about the opportunity. So that's about all I have. Make it quick.
He's a little bit more wordy than Taylor, but not a lot.
Okay, any requests for future agenda items? Supervisor Otino.
Number one, going forward, I believe we have a limit of supervisor questions and time on any one subject, and I'd like to see that we abide by that, if I'm not mistaken. And the other one, I know it's a little late, I should have brought it up last month, and I don't mean to give you any more, well, any gray hair, excuse me, Ken. I would like to see, at all possible, coming up to the COW meeting that we have, to maintain all our department budgets as close as possible to the current level right now. What we're asking our community in, and hopefully it passes tonight, it's a lot of money, and I think the general feel I get from constituents is that taxes, 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 and I think everybody hears that. So as close as we can to eliminating any of the big things that maybe aren't really necessary would be great. Thank you very much.
Other requests? Okay, any county clerk's report, correspondence?
I just have one thing to mention. I did put this announcement that came out today about the conference that's coming up in September in everyone's mail. It does say that the block opens on May 2nd, and I can almost guarantee you that by like May 3rd, all the rooms there will be full. So just as soon as you can let me know if you were interested in going, and if you'll be having a guest, you can just send me an email and I will get you all set up to go. Thank you.
Wonderful. Looking forward to a long night tonight, or? Okay, I just want to throw out a couple things. I want to shout out to our Veteran Services, Phil Landgraf. I got a wonderful email from a citizen who Veteran Services had helped tremendously. We're very, very appreciative, and it's just great to know that we're providing those kind of services to our veterans. So that was really, really nice to see. Also wanted to mention that if you hadn't noticed, in the April Wisconsin Counties magazine, there was a really nice article by Heather Jensen, Phil Galley, and Lisa Plunkett. I thought I saw Lisa here. There was a really nice article, nice to get exposure in the Wisconsin Counties magazine. So if you take a look at that if you haven't seen it. One other item, Ken had mentioned the card that went out. The other part of that card that you all, I'm sure, saw and read was alerting all of our citizens that we have an annual report from 2022. So I'm assuming that all of you have reviewed that, and I'm hoping that you have encouraged your friends and relatives and neighbors to also review that annual report. I'd love to get your feedback. I'm sure Ken and Adam would as well. The whole idea was to try to do an exercise in community engagement and try to help citizens understand what we do, help be as transparent as we can with our budget and where our tax dollars are being spent. So that was one exercise that we did that I'm hoping was well received. Would love to get your feedback on that. Next board meeting is Tuesday, May 5th, but also, as we mentioned, the community of the whole will be next Wednesday, a week from tomorrow, at 8:30 in the morning, where we'll begin our wonderful budget process. Other announcements? Yes. No, it was May 2nd. I'm sorry. Did I say? Okay. Now, was the regular board meeting is Tuesday, May 2nd. And then the committee of the whole is April 12th, Wednesday, 8:30. Yes, Supervisor Otino.
Thank you very much. My wife informed me today that this year's snow total was equal to the 1983-84 snow season. And that's before I even came to Wisconsin. Even before I even came to Minnesota, I was still back in Michigan. So I just thought I'd point that out.
So let's give a shout out to Robbie in the back there and all of our plow drivers.
I'll pass it along to the crew.
Yes, please do. Okay, it is 6:39. We are adjourned.